Hi, I'm Loula, and I'm a psychotherapist in the section of Psycho-Oncology in the Department of Supportive Oncology here at Levine Cancer Institute. And welcome to Sleep Basics. Many cancer patients have issues with sleep. In fact, about 60% of them report having symptoms of insomnia. And you might be one of them since you've tuned into this video. So in this video, we're going to be talking about some tips and strategies for improving sleep in cancer patients. So I'd like to start out by talking about why sleep is so important. It reduces fatigue, and it even can help with cancer-related fatigue, which so many of our patients deal with. It improves memory, decision-making, attention, and mood, and it can help us maintain a healthy weight. And the way this works is, actually, after a poor night of sleep, you tend to consume more calories. It restores and repairs vital bodily functions, cells, and tissues. It boosts the immune system, and it decreases stress hormones and inflammation, all of which are important from a cancer standpoint. So the tips we're going to be talking about can be put into three categories. One of them being quieting your bed, then quieting your body, and quieting your mind. So in terms of quieting your bed, interestingly, staying out of the bed is a good thing to do. So sleep only as much as you need to feel refreshed the following day. And restricting your time in bed actually helps to consolidate and deepen your sleep. And so typically what happens is when we're having trouble sleeping, we tend to go to bed earlier thinking we're going to sleep earlier, but that doesn't happen. So the time spent in bed should equal about the time you can actually sleep. So an example of this would be, say you're in bed about 9 hours, but you're only sleeping about 7. Then we would recommend that you restrict your time in bed to about 7 hours. And then, as your sleep improves, you can gradually increase your time in bed. Avoid naps and stay out of the bed during the day. Here's staying out of the bed again. So staying awake during the day increases sleep pressure, and this is something that can help push us through the night when we need to sleep. So avoid naps, but we understand as cancer patients, they may be unavoidable. So if you must have a nap, we do recommend no more than 30 minutes. And this is really for people who are having trouble sleeping. If you're not having any trouble sleeping and you can sleep and you can nap, go for it. Also, to quiet your bed, take a look at your bedroom or your sleep environment. Make sure your bedroom is quiet, dark, and relaxing. Remove any electronic devices such as TVs, computers, and clocks from the bedroom. And make sure your bedroom is a comfortable temperature. Cooler is better. And train yourself to use your bedroom only for sleep and sex. And so what we're saying here is, don't read in bed, don't watch TV in bed, don't use your laptop in bed, mainly for sleep. And this will closely associate your bed with sleep, and it has a conditioning effect over time. So now let's look at quieting the body. And so for quieting the body, a lot of what we do are consistency and routines. So get up at the same time every day, 7 days a week. We recommend setting an alarm to wake up at a consistent time every morning, regardless of how little you slept, even on the weekends. And again, this will have a conditioning effect, so it will train your body to know when to sleep and when to wake. And you can gradually sleep in on the weekends once your sleep improves. And the main thing to remember here is to avoid big changes to your sleep schedule. Exercise can also help quiet the body. And the way this works is that exercise increases body temperature, which facilitates a more radical decrease in body temperature afterwards. And since you sleep better in a cooler temperature, that radical decrease in body temperature is thought to help you sleep. Allow at least 3 to 4 hours between exercise and bedtime. And a hot bath or a shower an hour and a half to 2 hours before bed also causes that decrease in body temperature. An evening ritual that includes a hot bath or shower can cue your body for sleep and relaxation. So it's a nice ritual to create. Eating regular meals and not going to bed hungry can also quiet your body. And what we mean here is if you're hungry, you're going to wake up. And we used to tell people eat a snack before bed, but rather than doing that, the best thing to do is have a nice dinner, eat enough at dinner, and this way it will sustain you through the night. Avoid excessive liquids in the evening. Rule of thumb, no more than a cup of liquid 4 hours before bed. And this is so you're not getting up and going to the bathroom every so often. And cut down on all caffeine products. Caffeine interferes with that sleep pressure, so it will interfere with your ability to sleep. Be conservative. Avoid caffeine if you're prone to anxiety and hot flashes. And remember, caffeine is not just in coffee. Avoid alcohol. Now, alcohol does promote relaxation and it does have a sedating effect. However, after a couple of hours of sleep, you might experience rebound arousal or rebound insomnia, which wakes you up, and it may occur just a couple of hours after going to sleep. Dehydration can also promote awakening. Smoking might disrupt sleep, and that's because nicotine is a stimulant. So now let's talk about quieting your mind. So one of the things that we recommend is don't try to fall asleep. You can't really force yourself or command or will yourself to sleep. So if you notice you're struggling with this, let it go. And a lot of times what will happen is you're sleepy, you climb into bed, and then all of a sudden you're wide awake and you know when you're alert. When you're alert in bed, it's probably time to get up, leave the bedroom, and do something different. So you might watch a little TV. I recommend something boring, not too intriguing, and reading. I think reading is probably your best bet. And then you can return to bed when you feel sleepy, which about 30 minutes is fine. And to quiet your mind, don't take your problems to bed. We recommend taking time earlier in the evening for planning. And keep a notepad by your bed for jotting down any thoughts or anything that pops into your mind that you may have forgotten about. And schedule time for problem solving. Oftentimes, what happens is that at 3 in the morning, you may wake up and you're worrying about something or trying to solve something. So, if that's happened, ask yourself, if I worry about this right now, will I solve the problem? Chances are the answer is going to be no. So, schedule it for another time. Avoid using electronics before bed. And this is not just for the lighting, but it's the content that we mean here. So sometimes checking email or work email, social media can be a little bit distressing before bed. Slow down and pace yourself. Don't overschedule your day. And create structure and consistent routines in your day. There's so much uncertainty with cancer and unpredictability that sometimes just our little simple routines or our daily little structure is something good to hang on to that gives us some predictability. And make contact with the present moment. And here we're talking about all the wonderful things that we do with meditation and mindfulness and relaxation exercises. And be flexible. Life is going to have good and life is going to have bad. And if you're flexible, you can navigate both. And let go of the need to know. There's a lot of uncertainty associated with cancer, and sometimes you're just not going to have the answers you want when you want them. And so if you're struggling with knowing something that you don't have an answer for at that moment, let that go. You'll know when you know. So we hope these tips have been helpful. However, if you need more help, we invite you to attend a virtual class, Sleep 101. It's the third Thursday of the month from 3 to 4:30. And in Sleep 101, we'll dive in a little bit deeper into some of these things, and we talk about all kinds of sleep issues. And you can bring your sleep issues, and we can talk specifically about what's going on with you. You can ask your questions. To register, simply call 980-442-1006. We also have a treatment method that we offer. It's a 6-week program called Cognitive Behavioral Therapy for Insomnia, or CBTI. And this is the recommended first line treatment for insomnia. It's very effective. We work with you on with a sleep diary, figuring out what's really going on with your particular sleep pattern. And we work with things like sleep restriction, and we really structure your sleep. We work with anxiety and thoughts and worrisome kinds of things that may be interfering with your sleep. So if you're interested in this, simply ask your provider. And then acupuncture can also be helpful for sleep. And in with many cancer patients, you're already doing acupuncture for, say, joint pain or maybe some neuropathy. Just ask if they can target sleep. So we hope this has been helpful. Let us know how we can continue to help you with your sleep issues. Thank you for listening and watching.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.